Hey fam, you've heard me talk about the dangers of bruxism, that is clenching and grinding disease, before often. If you haven't, please take a look at these videos on our channel just to fill yourself in. Today we're going to dive right into bruxism self-diagnosis, the warning signs to look out for and the tests that you can do to identify if you have a problem with this disease and whether or not you need to see a professional about it. That these are stressful times. Most of us are on autopilot just to get through the day. We're not aware of what our bodies go through day to day, and it will just push through tension, anxiety, even quite severe pain. In many situations, this may be considered a beneficial adaptation, like progressive overloading at the gym. More weights means that you're increasing your strength over time. But when it comes to knowing and responding to our body's needs, this lack of awareness can not only be masking underlying disease, but even damaging our bodies irreversibly without our knowledge. And the damage can range from small cracks in the enamel of the teeth all the way to osteoarthritis and permanent dislocation of the jaw joint. So if I ask you whether or not you're clenching and grinding, you'll probably say no. I'd say 7 out of 10 of my patients who have actually done permanent damage to their teeth through bruxism are unaware that they even have a problem. This is something that we need to be worried about. So, how can you, at home, identify whether or not this is something that applies to you? I'm going to go through 4 things that you can do right now at home to identify whether or not this is a problem for you. Number 1, trigger points or pressure points. That's just basically a knot or a sore area of muscle. So we're going to feel all of the usual trigger point areas in the 3 main muscles involved in clenching and grinding. The first is the masseter muscle. We can feel this one very, very easily because it's quite superficial along the bottom back part of the jaw. And we're just feeling relatively gently to see if there are any knots or sore, painful areas. That's pretty good today. The next one we're going to feel is called the temporalis. It's a big fan-shaped muscle that goes across the side of your head like this. And to feel for that, we're going to go to the top of the masseter here, where you meet bone. That's your cheekbone. Now, the temporalis is a bit harder to feel because it's much deeper, but we're pressing inwards and upwards, about 30 or 45 degrees, and we're going forward along the underside of that cheekbone. And if you have temporalis tension, you'll feel it up here in your temples. It'll be quite sore. The tension is radiating up into this area. And the third pair of muscles are called your lateral pterygoids. So you went masseter forwards for your temporalis and upwards. We're going to go backwards to feel whether our lateral pterygoid is tight. And if it is, you'll feel tension deep towards your jaw joint, maybe going into your ear, backwards a little bit. Whew, that's a tight one. That's how you can feel for trigger points and see if you have any muscle tension in any of those 3 pairs of muscles. Next is the carrot test. This may come as a bit of a shock to you guys, but your jaw and your facial muscles should not hurt when you're eating anything. We find that a good benchmark to see how much tension you're actually holding on to is to see how your muscles feel, or whether or not you can even eat a whole carrot. I know when it's coming up to my muscle relaxant injection top-up time because I actually can't finish a carrot. My jaw muscles get so tired, I literally get maybe 3/4 of the way up and I have to stop eating. The third thing is called the awareness chart. Now, this is an exercise that we developed and we use with our patients over a period of 2 weeks, where they check in as soon as they wake up and just before they go to sleep, their facial muscles, to see how they're feeling with a red, yellow, green traffic light system. We've found this helps massively to build a level of awareness that empowers our patients to get their tension under control by minimizing that unconscious clenching and tension, bringing it to the front of their minds. Now, just for you guys, if you feel like the awareness chart exercise might be beneficial to you, I will make them available to you free of charge. Just drop me a comment or send us an email. The fourth, and probably the easiest and most obvious to identify, is called the Linea Alba, which translates to white line. In a well-lit environment in front of the mirror, take a look at the inside skin there of your cheeks. If you're clenching or grinding, the teeth and the friction between the teeth, or the cheek getting caught in between the teeth, getting clenched on, will actually thicken up because of that friction, and you'll see a white, either kind of S pattern or a white line going across the insides of your cheeks. So, now you know how to identify if this is a problem for you. Let me know what you discovered in the comments below, and stay tuned. Tomorrow we'll be talking about some of the home remedies and professional treatment options to protect your teeth and keep you out of pain. Stay safe and smiling, guys. Thank you so much for watching, guys. If you got something out of this video or if you enjoyed it, please share it with your friends. Otherwise, there's much more on our channel right here. There's another one there, and there's one more right there. Hopefully we'll see you soon. Keep smiling.